red, we're going to drive the blue, but we're going to create the environment for you to drive the red. And so in a population of 30 million, and I must say that we spent almost an hour in cabinet this week debating the population of Lagos based on the evidence that we have, because it's such an important number, and not just the number, but the trajectory. Right? And essentially, we aim to be a top environment for business. We want to be in the top 5, not only top 5 cities. I think we're number 2 or 3 at the moment in terms of cities, but we want to be a geopolitical space that can be ranked with any other country on the continent of Africa and beyond. And so these are the KPIs of this LSDP. And of course, things are changing very dramatically. So we set our target at 50% of Lagosians will be insured in the next 10 to 20 years. We want an inbound flux of medical tourists. We want government to raise its budget from 7.6% to 15% allocated to health. And we just heard about the bed deficit. We have about 50 beds to 10,000 population. We need to increase that to 230, either physical or virtual beds. And then we want to improve on our indices. And for us, these indices are not very attractive, but they do reflect that Lagos is quite often a victim of its own success. Now, this is a trajectory. And I keep this as one of my golden slides because it really is the function and role of government to look at these kinds of slides and think 5, 10, 15, 20 years ahead. So in blue is the population of most of the world. This time it's Europe, but the global populations, and I have another slide, there's only one continent in which there's an exponentially increasing population, and that's the continent of Africa. Everywhere else is flattening or in fact declining. So what does that tell us? It tells us that in the next 20 years, by the turn of the century, we're going to be the most populous continent in the world. But let's not go that far. Let's just go 10 or 20 years. Nigeria's population will double. It's already 230 or odd. Whether that figure is right or not, I'm not sure. But Lagos, whatever its population is also going to double in the next 10 to 20 years. Now, where are we going to put those people? And how are we going to look after those people? And what are those people going to mean for us as a state? So for us as government, we have strategic goals and KPIs from the LSDP. And really, I've put it again in red. What is the function and the role of the private sector? It's to include the private sector in the process of driving healthcare systems performance in a sustainable manner with, as you heard, bankable projects. So what are the fiscal realities? As you heard, more than 70% of Lagosians are still purchasing health out of pocket. That is not conducive to investment, neither is it conducive to welfare. If every time you have a medical crisis, you have to put your hand in your pocket, you may or may not have reserve. If you don't have reserve, then you're driven into poverty. And the whole family and the network suffers. We also realize that 60% of our population access their healthcare in the private sector. And when I say private sector, I don't always mean the formal private sector. I may be referring to the informal sector, which are the alternative medicine practitioners, the vendors of drugs, the hawkers, the patent medicine vendors, and the community pharmacists. Because of the way the economy is going, A lot of our citizens, either culturally or for economic reasons, access their healthcare at these informal interchanges. So the fiscal reality really necessitates a strategic mind shift in the way we do business in terms of accessing health. So these are the roles and the responsibilities. On the left is the function of government. Policy and regulatory frameworks, public facility ownership and establishing benchmark standards, government budget allocation, and equity and social protection, public health programming, oversight, and accountability. And on the right is what we expect from the private sector, which is shared capital, infrastructure and finance, service delivery capacity, technology, resources, and the big pharmaceutical chain supplying, market efficiency, which helps us to drive Lagos as a competitive geopolitical space. So these are the areas that we're looking to private sector: service delivery, pharmaceutical, big pharmacy, technology, infrastructure financing, education, and a very big area that is almost totally malnourished, which is research and innovation. So this was the old school, the traditional approach, and Lagos State is trying to shift gradually onto the right-hand side, the green. So what we tended to do was to attract private investment through tax holidays and duty waivers and donor-driven incentives, regulatory exemptions, ad hoc subsidies, short-term project grants, and limited accountability. But we're moving away from that. We're moving to a shared partnership, joint venture between government and the private sector, which are more bankable projects. We're trying to take care of the demand side, because if you guarantee the demand side, then leave the principles of business to operate. The invisible hand of business and the economy will kick in. The moment you give the environment the ability to pay for a service, then the services appear and they start to compete with each other, and the quality of those services start to be enhanced. We want streamlined, enabling regulatory environment. Enabling is the key word here. We don't want a regulatory environment that is sort of an obstacle and sort of undermines the ease of doing business. But regulation is critical. And you all as private sector know that it is important to have regulation, because there are all kinds of forces that are trying to encroach on legitimate business structures. So regulation is key. Structured cross-subsidy through risk pooling and social justice structures. And then much longer term PPP, JV concessions and performance matrices. Government really is not trying to make profit here. Yes, we want some of the profit back so that we can plow it into social systems, but we're more interested in the private sector flourishing and the people benefiting from a combined relationship between government and the private sector. So these are the three streams. The blue stream really is pure government initiatives, and we are looking at a ratio of about 1 to 10. So for every one public facility, we want about 10 private. Okay, so that one public should be the standard. Everybody sees what government has set up. Everybody follow this example. And then we have in the amber, we have the public-private relationships, of which there are multiple permutations and combinations, from concessionary relationships to joint ventures, build, operate and transfer, and so on and so forth. And then in green is the pure private. Government has nothing really to do with this, other than to have created the ambience for you to flourish. Like what's happening in Dirty December November, December, January, February, Lagos explodes. It's because government is creating that narrative. Government is enabling it, but we're not actually participating in it. So we want a Dirty December revolution for the medical fraternity as well. And it's happening. So government is involved in the first two, and then in the third one, we are involved, but not directly. So let's talk about the demand side financing, because this is critical, and Mrs. Lawie spoke about it, because if we don't get the demand side right, nothing works, all right? So the role of health insurance, I mean, there are multiple ways of getting the demand side financing correct, and we're going through a healthcare financial reform strategy at the moment. But you heard this narrative, around 77% of people are paying for health out of pocket. Guarantee, downward trend in the economy. People will flee Lagos, they will go abroad, because relatively people cannot pay what our professionals need. And so we need to do something about this. And what we've done is we've adopted the National Health Insurance Authority Act, which came out in 2022. Lagos State is the only state to domesticate this act through the executive order. And essentially, I'll run through it very quickly. It says that if you live in Lagos and you're enjoying the commercial environment of Lagos and all the attributes and safety and all that, your civic responsibility is to own a health insurance. And it's not going to be optional. We're not encouraging it. We're not advising you. We're telling you, you must have it. It's as simple as you want to drive on the road, you buy your car, you get your license, the next thing you get is a car insurance. And when you do have your accident, you're happy that the government made it compulsory. Similarly, when you have your medical emergency, you'll be happy that you have one or two insurances in your pocket. So what are the attributes of the executive order? Essentially, we're not draconian. We're going to do a massive public health campaign explaining to Lagosians the principles and policies and strategies around health insurance. We're going to partner with the private sector again, partnership with private sector. And this actually is one of the key attributes of this initiative. We're going to, after a period of public health awareness, we're going to start the enforcement. So in Lagos, there are things that you need where we're going to say, if you want this, you have to show evidence that you have insurance. And so we're going to start to implement that maybe towards the end of this year. And then, resources will be set aside for emergencies. I mean, those of you that are in the medical fraternity, if there's a building collapse or there's a train smash or there's a pileup, injured people are rushed into the nearest hospital. The first question is, and these kinds of people in these circumstances cost a lot of money. Who is going to foot this bill? So Lagos state government has to do something about this narrative. And what we're saying is that from this, the proceeds of this executive order, we're going to set funds aside, making it a policy and a standard that an emergency is an emergency. You manage the emergency, and then we talk about settling the bills afterwards. But you're not afraid to do the best thing you can do for your patients. And then, obviously, through the social justice parameters of the executive order, we can move funds away from the well-to-do to take care of the indigent population and the vulnerable population, which is something that the government has built into this, and obviously to address supply side. So by the time we put in all these narratives and we start to enforce, we're going to see a dramatic uptake of insurance, both in terms of either the state government social health insurance or the private insurances that we're partnering with, and I'll explain that shortly. And so once we have reached this sort of exponential increasing in insurance uptake, then we're addressing this whole narrative around demand. That now Lagosians have an increased purchasing power of health, for health, whether they use it as much as they should, or whether they think that this is a luxury, or whether they use it during times of emergency. The fact is that they have spending power backed by insurances. And so this is the partnership between the public and the private. The law says everybody must have a social health insurance bouquet of services. That is about the most basic minimum package of services you can have on an insurance scheme. And that's basically to be your social safety net. Now, those of you who have very elaborate private healthcare insurances, you will now be saying, well, I'm now breaking the law because I'm not in compliance with the executive order. So what we've done with the private sector is we're working with the private sector insurance HMOs to say, okay, let us build the minimum service of package of services that is associated with the social health insurance into your private health insurance in a way that is very obvious. And so when you have your private health insurance, you're covered, you're now compliant, and we can demonstrate that. And in return for that, we will do certain things for you as government. And those things we're doing is because there's been almost a competitive war between the HMOs in terms of undermining each other and really creating what we call a race to the bottom. So we're going to stop that. And the only entity that can stop that is government. So what we've done is we've brought the HMOs together, we've brought in actuarial scientists, we've defined the premium packages. So you can't go below a hard floor. So when you're offering these packages to the corporate sector, another HMO cannot come and say, I can do this better for you at a lower price. And when we allow that to happen, then the race to the bottom happens. At the end of the day, two people suffer. The client, who owns the premium, because when he wants service, you're now bouncing him from left pillar to post, trying to find the cheapest provider. And then ultimately, the provider, who are our doctors, our nurses, and our special healthcare professionals. And if you squeeze the providers, what are you doing? You're squeezing them out of the country. So, we are responsible for the brain drain. Did you think about that? We complain about it. But who are the catalysts to the exit of medical professionals out of this country? You never argue with your lawyer when he gives you his bill. You never argue with your architect when they give you their designs. But you want to squeeze the life out of the medical fraternity. So, when you complain about brain drain, look at yourself. We are responsible for brain drain, and we've got to stop that process. We've got to have standard premiums, and you can't undercut each other, and that is what government is going to do. As soon as we launch this program, it's been a struggle because the private sector hates this. And there are so many people benefiting from this abnormal relationship between the HMOs and the corporate sector. So we hope that this will be the beginning of the end of Japa syndrome. Japa syndrome, thank you. Japa syndrome is an economic narrative. That is all it is. The moment you cure the economic narrative, it will stop. And guess what? It will reverse. Because there is no, I've worked all over the world. I've jackpot 4 times. And you know what you do when you jackpot? You all meet on Sunday as Nigerian Association of Doctors in South Africa or in America or wherever. And while you're eating your pounded yam and your egusi, the narrative is always, oh, I wish I was back home. I wish I was back home. I wish I was back home. If back home now becomes conducive, what would you be doing out there in the environment of Trumpism? You wouldn't. Most places are going extreme right now. So that place is not for you. So yes, we don't mind people going abroad. Actually, it's beneficial. Go abroad and learn some fantastic skills at no expense to Nigeria. But after 5, 10, 15 years, come back home. Bring them back. But we have government and private sector need to have created that environment for you to flourish. So, am I going back or front here? Sorry. So that's the demand side, and I hope I've made it clear. So those of whenever we talk about this, and please help me because I'm under a lot of opposition to this strategy. So I need the industry, I need the private sector to understand that we are responsible for the Japa phenomenon. And we must take this bull by the horns. Now let's look at the supply side. So I'm going to talk about the government side and the PPP section. I'm not really going to talk about the great institutions of Lagoon, the Duchess, and the Evercare because while they're very, very important, they are the third tier that I talked about, and they are the tier that are exploding because we believe we are creating a dirty December environment in Lagos for the medical fraternity. But let's talk about the government side. So we've looked at our infrastructure and we says, wow, our infrastructure is almost colonial. Some of our hospitals were built when the British were here. And some of our designs, Mr. Governor said, hey, let's scrap all this and let's start again. So we've started to work on green designs. And we brought a lot of designers, architects from all over the world to work with Nigerian designers. And we developed lots of prototypes, that are conducive to our environment, conducive to our culture, conducive to an environment that's comfortable for our patients, comfortable for our climate, and comfortable for our staff. And we've come up with key issue around energy, because we know what's happening to the energy. So our new green hospitals are about a third of the cost to power. That is a typical hospital at 158 million naira a year. And our green hospitals are down to 60 million naira a year for energy alone. And if you're driving along Osborne Road onto the third main, if you look on the left, you'll see one of our new infrastructures, the new Massey Children's Referral Specialist Hospital, which it's reached its 10th floor, and maybe in another 3 to 4 months, we're going to complete it and commission it. This is the largest dedicated children's specialist hospital, as far as we know, in sub-Saharan Africa. We have the massive Ojo Iba General Hospital, a big gap between Ali Mosho General Hospital and Badagry Hospital, massive constituency there. So we put this gigantic general hospital there. It will be ready in 2 or 3 months. This is not a general hospital. This is a specialist facility, secondary facility, almost ready. Doctors' quarters, all kinds of modern equipment is going to be in there. We're very, very keen to commission and operationalize this. Now, Mental Health Institute, the biggest mental health institute in West Africa. 1,500 beds. We're going to soon complete 500-bed psychiatric component of it. It's built on 15 hectares between Ikorodu and Ekpe in a place called Ketu Ejiri. We're about 70% complete now. We're not going to make this a madhouse. This is going to be a mental health institute where we're going to define the forces in a mega city. Now, a mega city does things to people, all right? There's a lot of strain on your brain. I like that, strain on your brain. Okay? And so when we are building megacities in Africa, we've got to have institutions in place, in the community, that protects your brain from strain. All right? So this institute will be a conglomerate of international scientists that study the brain, study behavior, study inborn errors, study pressure, and we're going to move care into the community, but it's all going to be happening from this facility. Then we're building the new Shomolu General Hospital, the old one, servicing 7 million people. If you go there, I was there again last week, it just amazes me how creative we are as a people. It's almost like, you know, what your children, those Lego toys that your children have. The MD has put one porter cabin on top of another one, then there's a stairs going there, then there's another one there, then it comes down, then it goes to another. And I'm just looking at this thing and wondering, wow. 100,000 patients registered in this Lego structure. And that's the old hospital. So we said, okay, we're going to build you a new hospital. And let me tell you a secret. That was the hospital that the First Lady of Lagos, that was her hospital before she became First Lady. She was the MD of that hospital. So I promised her that I would do something about this hospital. And so we got the land from the local government. And we've collapsed the local government structure. We're building a brand new hospital. This is a 3D design, but that's what it will look like in about 18 months from now. Okay, and then we've got the Infectious Disease Research Institute. You know, we learned a lot from COVID. And this is what we need to do. We need to really, Lagos is the most densely populated megacity on this planet. The population per square kilometer is huge, which means that any contagion, whether it's airborne, waterborne, touchborne, or transferred through dirty December partying, is going to spread like wildfire. And so we need to be on top of our game. And we need to be able to build a biosphere of protection to make sure that we're not shocked by pandemics. Again, another green building. We've completed the design. We're now looking for some resources to build it. And this is the primary healthcare headquarters. Really, they had a very old, decrepit headquarters before we demolished it, and we're building them a brand new headquarters. One of our favorite designs is our primary healthcare. This is the core of the building. You will notice that there's a lot of outspace and fenestration, but this is inside a capsule. And the capsule is perforated, so it's protected. There's one roof, and then there's a false roof, and the core is where the activity happens. And we've designed this to be a very cool, energy-sufficient building, and also to have our waiting rooms in what we call the outside-inside. So you'll be outside, but you'll be inside. So you will not be suffering from the risk, and that's the roof. The roof is a complete solar paneled generator, so it can operate off-grid. So we're going to start replicating these buildings across Lagos. Now, you heard that budget was not, we're competing, and Dr. Fola alluded to that. So the government is looking for developmental funds, and Lagos State is really engaging with African Development Bank. Our institution is involved, the JNCI are involved with us. We're looking for a funding gap so that we can address and take the government side of the supply side up as fast as possible. We're dealing with the demand side, we must deal with the supply side at the same time, while we're now encouraging the private sector to kick in. And so, I'm almost reaching the end. Leveraging the private sector capacity, we have to do a lot of things, PPP, concession or JV, and these are the cycles of activity. Government can provide land in a PPP. We need to share the development of the health infrastructure, the cost. We need to provide fiscal incentives, and the government needs to offer some of its public services to these PPP functions so that there's continuous volume of services being driven through these public-private partnerships. And so an example of a public-private partnership, and I got approval in cabinet only this Monday for us, thank you, to build the largest comprehensive cancer center in Nigeria, in Alausa. And these are the partners. JNCI, you know them, they're also part of the Medipac consortium. And this is being built on a very large piece of land in Ikeja. Why did we choose Ikeja? Close to the airport, so that we are attracting inbound tourism from the rest of Nigeria, the rest of West Africa, because we're building this really for Nigeria, not just for Lagos. And so in the Comprehensive Cancer Center, we're going to have radiation oncology, medical oncology, surgical oncology, and bone marrow transplant in a phased process approach. So this is one of our star PPPs between government and private sector. Essentially, going by this formula that I've outlined here, so that there's a shared responsibility. It's a JV, it's a joint venture between private and government. Government is putting their skin in the game. Private is coming. And when you bring these two together, you are now creating a more bankable project that developmental funders and foreign direct investment are more keen on supporting. And then this is a very, very popular, going to be an iconic structure, right opposite the boat club. That's Fola's baby. It's called the Medipac. Again, on a nice piece of land, right in the center, fantastic position. You can see all the partners involved there. We did groundbreaking almost 18 months ago, and I can see when I drive past, the structure is rising out of the ground. You're due for a visitation from the Ministry of Health anytime from now. And we're hoping that, this is going to add another feather in the cap of Lagos State government, where we're driving and we're striving to become the center of medical tourism for West Africa. Now, it's not just about infrastructure. There are huge opportunities around programmatic work. And I'm just going to choose one program, malaria, quickly, because I want to get to the end. But I also want to illustrate that it's not just about bricks and mortar. So Lagos State has been struggling with a narrative around malaria. And, I presented the data to Mr. Governor about 2 years ago, and we were really confused by the data because in blue, the WHO are telling us that our rollback malaria is working and that the prevalence of the parasite in the community is declining. But yet, we're still diagnosing 80% of fevers as malaria. So there's a problem there. We call it the paradox, the Lagos paradox. And the doctors in the room are smiling. I can see them. So Mr. Governor said, hey, please, go and figure this out. What is going on? We can't have these discrepancy between epidemiology and clinical presentation. So we said, okay. We put together a coalition of credibility, and I had to put together a coalition of credibility. Otherwise, you guys would not believe me. So on top of that coalition is WHO, then the National Malaria Elimination Program. These are serious people. And then the Pharmacy Council of Nigeria and some of our private sector partners. And we set out to try and find out what's the true burden of malaria in Lagos. Here's the proof. So we got some of the top malariologists in the world. Some of them happen to be Nigerians. And we said, okay, we want you to give us a means of measuring how much malaria we have in community. And the typical tool is the microscope. It's big, it's expensive, it requires light, it requires expertise and reagents. And they said, okay, let us compare it to WHO accredited rapid diagnostic tests. And we found out that the RDT, the WHO pre-qualified RDTs for malaria, are even more sensitive and more specific than the microscopy. Did you hear me? That little gadget is not the size, not bigger than this thing. It's much more effective than that thing. And it comes fast and cheap. And it will pick up more malaria than this one. All right? So we started to deploy those in the community. And that's what it looks like. 1 bar is negative, 2 bar is positive. You all know what it looks like. And we went into the community and we tested 88,000 people, the largest epidemiological malaria study in Nigeria ever performed in the last, this was 2025. And you can see the variation, climate variation, dry season, rainy season. And out of every 100 fevers at these 514 facilities, 392 in the community, the PPMVs and community pharmacies, 122 in the PHCs. And what did we find? That malaria really is no longer the commonest cause of fever in Lagos. So once we got this narrative, we now changed our policies. In a government facility, you will not diagnose malaria without a rapid diagnostic test. Once we made that announcement and that policy, look at what happened. From 80 to 60% overnight, it crashed to 5%. Now, Mr. Governor saw this data and said, He said, now you're talking. Now we can change how we spend our money. Instead of wasting our money on drugs that you don't need, let us start spending money on proper diagnosis. Here comes business opportunities. So if 95% of fevers in Lagos are not caused by malaria, what's causing them? Now we need to put money into diagnostics. We need to put money into institutions. We need to put money into people that can make the correct diagnosis. And so this is opening up a whole load of business opportunities for Lagosians. And Mr. Governor and the Deputy Governor, having seen this new data, said, okay, what's stopping us from becoming a malaria-free state? The first geopolitical space in Africa to become malaria-free. If we're able to harness our resources, drop our expense on malaria, but at the same time create new opportunities for appropriate diagnostic strategies. Now, this is one of the last things I'll talk about. The transformation of healthcare in Lagos, called LASMIZO, the Lagos Medical and Industrial and Innovation Zone. And I told you that research and innovation are malnourished. So what we've decided to do is to conceptualize the LASMIZO. We want a space for massive explosion of medical industry for consumables, reagents, devices. But we also want to create a space, like we did during COVID. Before we rolled out our strategy for COVID, we brought great researchers together for about 3 months. We studied COVID in Lagos, and we realized COVID in Lagos is not the same as COVID in England or America or in India. And so once we understood what COVID was doing in Lagos, we were able to do the right thing for our people and save thousands and millions of people's lives. So we're working with the Lagos State Ministry of Commerce, Cooperatives, Trade and Investment to move the LASMIZO into the free trade zone. And this is the new Lagos. If you haven't been here, please go. At the back, you can see the refinery. There's a new airport that's coming in. There's already a new deep sea port. So Lagos has 2 ports now, the Apapa port, Tinkan, and the largest deep sea port in Africa at the Lekki Free Trade. This is a new era for Lagos. And we've positioned ourselves in here. And this really is the concept of LASMIZO. There are 3 parts to it. The middle part on the checkerboard is going to be where industry explodes, where we're going to invite pharmaceutical industry organizations, local and international, to partner with us to make us self-sufficient for our needs and to be able to export to our neighboring countries and the rest of Africa. On the left there is the research innovation pipeline. We need to turn our money to local scientists and academics. We need to do local research. We need to develop our own solutions for our own medical conditions. We right now import everything. They say they do clinical trials in America, in Europe, and they said, oh, when we're doing the clinical trials, we made sure we included between 5 and 10 people of African origin. So you can believe that these drugs work on black people. That 5 to 10% are African Americans, for example, who have been displaced from Africa by 500 years. Their epigenetics and their genomic codes are no longer the same as the indigenous African people. So the way they process drugs is different from the way we process drugs here. So it doesn't add up. Now, Lagos, which is the representation of Nigeria, there's no ethnic group. They say we have 500 ethnic groups in Nigeria. All of them are in Lagos. What does that mean? That is a huge economic opportunity for establishing Lagos as the center of clinical trials for Nigeria and for the Bantu race, which cuts across the whole of West Africa. And so we should be the place that big pharma come to carry out clinical trials so that you can be convinced that the drugs that are coming off these innovation pipelines are suitable for us, because high blood pressure here is not the same as high blood pressure in Europe or in America. And we all know that. The drugs are different. Diabetes is different. COVID was different. So we need to understand our own diseases and understand our own treatments. And we need to work with our genetic codes to figure out what is best for ourselves. And we need those pipelines. And Lagos State Ministry of Health has just set up an intellectual property desk. I think it's the first intellectual property desk in the health sector. Dr. Banke is involved in that. What are we trying to do? We're trying to put more money into local research. We're trying you to keep and protect your intellectual property so that you can enter these pipelines without it being stolen from the continent and added value abroad, and then they sell the product back to us. So we really need to get onto this bandwagon. And so the Lasmiso is not a place. Lasmiso is the end point of a number of activities from the public and the private sector. So all our new specialist general hospitals in public and private, our big medical and pharmaceutical manufacturing, our biobanks, our database, our research and innovation, the smart health information platform, and the new university are all going to feed into Lasmiso. So it is a concept, it is a network, it is not a place. And that's how innovation zones work. All right, this will just be the outcomes. I want to dwell on that. I want to end with the SHIP, the smart health information. Your sub-theme is about the digital transformation. Lagos has started the SHIP since 2019. In fact, our first conference in Governor Sanwo-Olu's dispensation was a SHIP conference, October 2019, and then COVID hit us. And so we had to slow down while we addressed COVID, but it never died. We've gone through it, we've allocated it to a concessionaire, and essentially we're going to digitalize the entire public health space as phase one, from our PHCs to our general hospitals, to our teaching hospitals, to our agencies, and then in phase two, we're going to go into the private sector. Why? Because we need the data. We need the health-seeking behavior of Lagosians for government, for policy, because we need to know where to allocate resources and also for early warning systems. And so this is what the SHIP will look like. And all these apps that Fola was talking about really are the push factors. They push data into the SHIP. And the SHIP becomes a platform of health information exchange. And for AI, AI can't work without data. Machine learning can't work without data. Computational analysis needs data. And so the data is really the fuel, you know. So these things, the apps will be pushing data, and then there'll be the pull apps, the apps that use the data to make life easier for the medical fraternity. And this should be a self-sustaining narrative so that it continues to improve and amplify itself. And finally, we need medical professionals to address this brain drain situation. When we're training medical professionals, what we need to train a doctor, a nurse, a dentist, a pharmacist, whatever, is the patient. We cannot train medical professionals in a classroom. They learn their trade by the bedside. And so, a population of 30 million, our data shows we see from that 30 million, we actually see 30 million patient encounters in the public sector alone, and probably an equal number in the private sector. So we're seeing a huge amount of patient encounters. And these patient encounters are enough for us to train to become the center of medical training in Africa. If you like, jackpot. But we have enough. And after you jackpot and Fola and her people are making Lagos the center of excellence for medical access, they won't stay there long. They will jackpot. And so the trick behind this is traditionally we used to train our medical professionals in one place, the apex, the tertiary academic center. We've now decided we're going to move training down to the secondary and into the primary and into the private sector. And therefore, Lagos is extremely well endowed. We don't need anything. We have everything we need to be the place for medical training as the capital. And so over the years, we've just passed the bill through the House of Assembly. The new University of Medicine and Health Sciences will start. I'm actually supposed to be in LASU today for their convocation, but I chose, because I committed to you, I chose to keep my commitment. But really, over the next 5 years, we're putting things in place to ramp up the intake of our students. So when students apply for medicine, for example, about 1,000 of them have the requisite grades, but we can only take 100. So where do the 900 go? So we have the capacity to train thousands and thousands of medical professionals. And we must harness it. And so this trajectory is what Lagos is aspiring to be the headquarters of medical professional development. So the lessons learned from including private sector, central planning, government must always retain central planning policy and legislation. Private sector inclusion is necessary. We must include the private sector early. So when we're developing our strategies, we must engage. And we must bring you in as co-partners and co-risk takers in the whole concept that we're defining. Of course, regulation of services is non-negotiable, but communication must be clear. And so in conclusion, policy and positive regulation are the most effective tool that government has. The right policies will increase the ease of doing business for the private sector and in return share the revenue generated to fund some of government's social safety nets and long-term sustainability. I want to re-emphasize government is not looking for massive profits. Government wants the private sector to flourish. And then thirdly, the government has no business doing extensive business, but rather providing the regulatory oversight, the benchmarking infrastructure, and creating templates and models for adoption by the private sector. Please stay in touch with me on my social media handles. You can go back and look at all the policies that we're pushing out on a daily basis. Really, Governor Sanwo-Olu's and Deputy Governor Hamzat's government policies and strategies in the health sector have been revolutionary. Thank you very much. Wow.
Thank you so much, Professor Akin Abayomi. I'm sure most of us will want Honorable Commissioner to continue making his speech. I know he's keeping a lot of things that he was supposed to explain. For time, we'll allow him to skip all of that. I want to ask Mr. Commissioner if we could share this with the participant. Do we have your permission? Thank you, sir. the participants will all have this sent to our email immediately after the event today. So we'll give an opportunity for just 2 persons to ask Mr. Commissioner questions. If you have, do we have 1, 2? Yes. Please, the questions, I will hold the microphone. So it will be, my name is John. My question is, no introduction, no preaching, no sermon, nothing.
Thank you. My name is Adebayo Temenu. I represent Simplify Global. Honorable Commissioner, sir, you were talking about the issue of malaria not being the cause of the fever that you've been able to identify in Lagos so far. What you have not told us here this morning is that what exactly is responsible for the fever that we keep seeing in every lab, in every clinic in Lagos? Thank you, sir.
Thank you. Since, so he needs to tell us the cause of the malaria.
My name is Yeye Adenike Shobajo. I rose to become Vice President of the Lagos Chamber of Commerce. I rose to become Vice President of the Lagos Chamber of Commerce and Industry, and I run an outfit, ASNA Communications. Honorable Commissioner, sir, cancer. Cancer has become something else that I'm sure that in any household, you will have a patient. In my house, my husband has stage 4 of the prostate. I have an enlarged heart. I lost my daughter, 42 years old, 3 years ago to cancer. And what pains me is that when she was going through the checks, they were treating her for gender, they removed her uterus, they removed her, what are those 2 things in there? Ovaries and whatever. And then said, come back 5 weeks later, only to discover that she had cancer in the stomach. And then she started bleeding. Right now, there's a talk about Ogogo. I think we all know. Please, what is the problem with cancer?
Thank you. Mr. Commissioner, the cause of malaria and the cause of cancer.
Sorry. Okay, thank you very much. Now, that's why I said that I had to put a coalition of credibility together, because I knew you would not believe it. And for me to get the governor to stand up and say that malaria is no longer the commonest cause of fever, he needs to be backed by science. He needs to be backed by the WHO. He needs to be backed by our great institutions. And so when I give him his speech and he's telling us that, our rollback malaria has worked, and out of 100 people presenting with fever, only less than 5% are attributable to the malaria parasite. He's telling you a fact. Now, you won't believe it, and I understand why you won't believe it, because you still get bitten outside, you still see water, drainage, this, that, and the other. But we're talking about evidence-based medicine, and that is what we do. We give you the facts. The fact is that there are up to 100 causes of fevers and feeling of malaria. What is malaria? We now discovered in our research that when someone says, I have malaria, it is our way, it's a kind of pidgin English. Malaria means I don't feel well. It's as simple as that. Malaria means I don't feel well. Now that I don't feel well can be caused by a virus, multiple causes of bacteria, even a phrase I've coined called wahalaria. So, wahalaria, stress-induced body pain and headache. And the first thing you do on your way to work is you stop at the pharmacy and say, I have malaria. No, what you mean is I don't feel all right today. but you stop and you buy your Coartem or whatever, you swallow it, and you on your way to work. But we're now talking about a whole new opportunity because a doctor and a pathologist can now try to understand what the cause of that fever is. And you will find out that half of the fevers are caused by viruses, of which there are a plethora of them. Most of them have no treatment. You just go home, take Panadol if you want, rehydrate, and sleep. Why? One, it boosts your immune system so you get better faster. But more importantly, number two, you don't give it to someone else. All right, so if you're sick, stay at home. Get to the doctor will tell you, I think you have a viral illness. Go home, rest. You now say, I paid you all that money to tell me to go home and rest. And you say, this is your doctor. And you go to the next doctor and you say, I have malaria. Is there another instrument on? I have another. You go to the next doctor and you tell the doctor, listen, I have malaria, I want injection. So the problem is not just with the medical fraternity. The problem is with the people. You are demanding a diagnosis and you are demanding a treatment. And the doctor wants business, so he's going to accommodate you. If you say you want injection, they're happy to give you injection. Guess what? In medicine, we were all taught, if your mouth is working, you have no business taking an injection. An injection comes with all kinds of problems. Yesterday, I was with the Pharmacy Society of Nigeria. Do you know we are the capital of antimicrobial resistance? What does that mean? It means that the bugs that live in Nigeria, in Lagos, have been programmed not to respond to antibiotics. Who programmed them? Sorry, you are all here. Everything you take goes in the urine, goes in the stool, goes in the sewage, goes into the system. And the bugs don't want to be killed. So they're saying, these people are pumping antimicrobials into the system. I'm going to change my genetic code so that when I jump on you, you won't have any. And their job is to kill you. That's their mission. Having said that, the number of bugs that kill you and cause disease are a fraction of the bugs in the environment. Most of the bugs in the environment are actually good bugs. All of you have billions of microbials. We call them the microbiomes. Now, if you take an antimicrobial for no reason, guess what? You're killing all your good bugs. And you're indirectly killing yourself. So it is a very serious phenomenon. We need to build a cage around restricted drugs. You shouldn't have access to them unless a medical professional who has done the right diagnostic process gives you a script with his MDCN number on it, recognizable by the pharmacist. You should not be able to go to a pharmacist and get an anti-malaria. You should not be able to go to a pharmacist and get an antibiotic. It is illegal. Go to America and try that. It doesn't work. Go to England and try that. It doesn't work. Go to South Africa and try it. It doesn't work. Go to Kenya and try it. It doesn't work. So why does it work here? But the worst part is actually the food. The food that you eat is pumped with antibiotics, hormones, and chemicals. And we're not practicing that delay period between when you give an animal an antibiotic and when that animal goes to the slaughterhouse. So you're all eating antibiotic-riddled food products, food chain. Because people want their product in the market. They want their product in the market. Now, our responsibility as government, both in the health sector, in the agric sector, and in the environmental sector, is to curtail the access of these antimicrobials. In December is going to be the World Conference on Antimicrobial Resistance in Abuja. The whole world is coming to Nigeria for this conference. an indication that Nigeria is a place where we need to do a lot of work. So back to the question, what is causing the fever? All kinds of things, but it's not as much malaria as you thought. In fact, it's 5 out of every 10 people with malaria. And in some parts of Lagos, a place like Lagos Island, Ikeja, you will hardly find malaria because it's built up. You will find malaria when you start going east and west. But when you're in the center, you know, the parasite, the larva of the mosquito, like you, needs clean water. So it's not going to breed in lagoon water. Neither is it going to breed in a trench or a drainage canal. But it needs a nice environment. All right. So malaria is not the first thing you should think about when you have a fever in Lagos. Go to your doctor. Insist on a malaria rapid diagnostic test. Ask to see it. Take a picture of it. And you will see that things will start changing. So if you're not well and your malaria test is negative, then the doctor now has to find out what is wrong with you. Now that requests a proper examination, a urine test, a swab test, a blood count, or whatever. And then we now open up the opportunities to tell you that either you need something else, because if we give you an anti-malaria and it's something else, we've delayed your accurate diagnosis by 3 days because the anti-malaria lasts 3 days. If you're not well after 3 days, that's when you recognize that, hey, this was never malaria. At that point, it might be too late. So this is serious business, and we need to actually change the mindset, change the way we practice, and change the expectation of the public. Malaria is not the commonest cause of fever in Lagos. I'm emphasizing Lagos, because if you go outside of Lagos, it's a different narrative. Madam, sorry about your loss. Indeed, cancer is growing globally for many reasons. One, people are living longer. The longer you live, the more chances you'll have a genetic accident which leads to cancer. Two, we're beginning to live in a much more toxic world. Everybody is exposed to some kind of pollution. Everybody has a cell phone. You use your cell phone for 9 months and you throw it away. That cell phone is full of metals, heavy metals that go into the ecosystem. You sleep with the phone next to your head. You're full of radiation everywhere. It's not a Nigeria problem. It's a global problem. Now, if you're living in such a toxic environment, everything around you is full of pesticides, it's full of hormones, it's full of heavy metals, you're stressed, nobody's relaxing. Instead of relaxing, you're TikToking, you know. So your body is in constant alert all the time. You don't sleep enough, you know. You're not eating wholesome food, you know. You're not eating food that is free of contamination. So, yeah, naturally, the incidence of malignancy or cancers will rise. At the same time, we are really advancing in the technology of cancer cure. When I first qualified as a doctor, and I'm a specialist in blood cancers as well, we could hardly cure any of those blood cancers. Now, we can cure up to 70% of cancers in the blood space. Solid tumors just as well, you know. So, you know, human beings are very good. As we're creating an environment that's conducive to more cancer, we're also creating an environment that cures more cancer. All right. But, you know, having said that, as Lagos, we have done our projection and we need about 15 of those cancer centers that I protracted there. We only have 2 at the moment, one in a federal institution, one in private, and a few other smaller ones. But this one is going to be a Lagos State Comprehensive Cancer Center. And as government, we want to set this up as the benchmark and then promote the private sector to build more cancer centers all over Lagos State so that we're picking up cancer early. The trick around cancer is prevention, screening, early detection, and quick personalized precision medicine bespoke protocols for individuals. So you're right, but we're also making a lot of progress in terms of treatment protocols. So thank you very much. I have to disappear to another event, so I'll take my leave now.
Honorable Commissioner, I know you want to run, but we like to do two things. We'll give you the plaques, take a photograph, then I would like you to speak with the press. Those two things. Yes. Photograph first. Mr. President. So we need to, I'm told we should use up. Honorable Commissioner, please let's come up. Yes. DG, Chair of the Dr. Ayobami, please, you need to join us here. Let's move to the middle, to the center, sir. Thank you. Come to this side. Yes, yes. Let's move a bit closer. Thank you so much, sir. Okay, for her too. Okay. I thought she's still around. She's not leaving us yet. So, media, please, let's meet the commissioner. Let's stand at the entrance. After the hall, please, to meet the commissioner, please, as he's going. Thank you so much. Media, please, let's meet the commissioner for questions while we continue from here. So we'd like to take one digital ad now while we settle down. Please, let's roll one of the digital ads. Panelists, please, let's take pictures with the commissioner outside just immediately after the media interview. Adebimpe, please, can I have you? We need to arrange the seat for the panelists now, please. Adebimpe. Adebimpe and Taye, please, let's have the seat arranged for the panelists while the commissioner takes his interview and the photograph outside. Yes, thank you.
Over 5,000 Nigerians
We will
travel
look
abroad
after
every
you.
month in
secret to healthcare living. Order prescriptions or shop online with us today.
All right, thank you so much. With that digital health, thank you. So we'd like to take a awareness session, which is just for about 5 minutes. 5 minutes. We're actually not doing well with our time. Please make welcome WellPath Physiotherapy and Wellness Limited representative. Let's put hands together for her or him as he comes up. Yes, thank you. 5 minutes. Thank you.
Hello, everyone. I'm very sure I've been sitting down for the past 2 to 3 hours, and you can't have a physiotherapist in your midst and stay stationary for too long. So if you don't mind me asking, can we all stand up, please? Thank you. Pardon me, we'll do this. Okay, so, sorry. Okay, we're going to start from the top down. We'll start with our neck. Everyone, okay. Can we bend our right neck, our right ears towards the right shoulder? So this is your right ear. Remove your ear towards your right shoulder and hold. You should feel a stretch on the left side of your neck. We're going to hold for 5 seconds. 1, 2, 3, 4, 5. Now bring it back to the midline. Thank you. Okay, now we're going to do the same on the left side as well. So moving your left ear towards the left shoulder. And you should feel a stretch on the right side of your neck. Thank you. Bring back to midline. All right, so we've been staring at the screen for hours. So can we bring our chin all the way down to our chest? Thank you. You should feel a firm stretch at the back of your neck if you're doing it right. Thank you. Now rotate your neck to the left, and then the right. Okay, thank you. So now we're going to move to our shoulders. Right, can you roll your shoulders upwards, up and down? Thank you. Keep doing that. 1, 2, 3, 4, 5. Some people realize they're stiff when they're doing that, but it's fine. Okay. So now we're going to try to bring our shoulders forwards, like we're trying to move them towards each other. No, you're not doing it right. Right? Exactly. Thank you. All right. So hold. You should feel from a stretch at your back if you're doing it right. Okay. Hold and then relax. Now we're going to do the exact opposite of that. We're moving backwards. So you're doing too much. No, not you. All right, so move backwards. Right, hold. 1, 2, 3, 4, 5. Relax. Okay, we're not done with the shoulder. Now I want you to try hugging yourself. Now place both hands on your shoulder and pull forward. No, you're pulling your shoulder with your hand. Sorry. One, 2, 3, 4, 5. Relax. Thank you. All right. So now I want you to sway from the left, right, and then 1, 2, 3, 4, and 5. All right. So let's go to our legs. We've been sitting for too long. For someone, you might have to hold the edge of your seat for stability. So Place your right leg backwards. Right leg, yes. And then your left knee, bring it forward. No, don't bend the right leg. Put the right leg straight. Hold. 1, 2, 3, 4, 5. Stay. Now we're going to switch legs. Left leg backward. Good. And then the right knee bend forward. Thank you. 1, 2, 3, 4, 5. Relax. Okay, you might want to use both hands on your chest now because we want to stand on our hips. So please hold on to your seats and lift your heels up from the floor and relax. Back down. That's one. And again. Up. So we're going to do some forward jogging. 10 seconds. Please indulge me. It's going to help us pump ourselves back and set. Exactly. So let's go. I'm going to count to 10, please. Can we jump? 10 seconds. Just stationary. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh, thank you very much. Please, can you give yourself a round? All right. So, thank you for indulging me. You can all have this. I would like to add, if any of those movements caused pain at any point, please see a specialist.
Welcome to Wellpath Rehabilitation Centers. We are able to provide you with 24-hour rehabilitation care. At the facility, you can expect to have 24-hour nursing care. In-house dining. And of course, world-class rehabilitation facilities.
Right. Thank you so much. We're now at the panel session. Like I said earlier, this promises to be the core of why we are present. There will be question and answer after this session, but permit me to bring up the moderator as she will be bringing up our panelists thereafter. Please make welcome from Nena Omeka, Chief Executive Officer at Mocare Pharmacy. Let's put hands together for her.
I'm here wondering how awful I look because I stayed awake preparing and I'm still nervous. It's a pleasure to moderate this very important conversation on scaling healthcare businesses in a digitally driven economy. Healthcare is experiencing a fundamental shift. the way we diagnose, deliver care, manage patients, procure medicine, process payments, and even make clinical decisions is changing. But technology alone cannot scale healthcare. We still have to contend with affordability, infrastructure, regulation, financing, workforce capacity, trust, and ultimately whether the business model is sustainable. So today, rather than simply ask what technology can do for healthcare, I would like us to explore a more important question, which is how do we use health technology to build healthcare enterprises that can actually scale, remain resilient, and deliver better outcomes? And I have an excellent group of people here with me to answer those questions. Our first panelist is Dr. Segun Bitami. Please welcome him. Dr. Segun brings a perspective on digital healthcare, healthcare delivery, and what it takes to build healthcare services around a technology-enabled model. Welcome, Doctor. Also joining us is Dr. Fumi Adewara. Dr. Fumi is the Chief Executive Officer of Mobi Health International, bringing valuable experience at the intersection of healthcare delivery, technology, and digital innovation. Joining us also is Adham Yeha. He's a co-founder of Drugstock. Dr. Yeha, whose experience is pharmaceutical supply chain innovations, brings an important perspective on medicine access, procurement, distribution, and efficiency. Unfortunately, the rest of the panelists could not join us. Thank you very much. Dr. Segun, let me start with you. We talk about scaling healthcare businesses in Nigeria. What does scale actually mean? Is it more patient, more location, more revenue, better outcomes, or a combination of all four?
Okay. First, I'd like to thank the Medical and Allied Group of the Lagos Chamber of Commerce and Industry for inviting me to this occasion. And in scaling healthcare, the most important thing should be outcomes. So scaling healthcare should be all four, but it should start with outcomes. And then it has to go on to finance before patient. Locations should actually be the last. A location for a healthcare is not a facility unless the outcome and sustainability is present. Patients don't care about buildings, they care about outcomes. Thank you.
Thank you very much, Doctor. Dr. Fumi, you operate at the intersection of healthcare and technology. We have used the phrase digital transformation so much that it can become more like a buzzword. What does meaningful digital transformation actually look like in a healthcare business?
Thank you. And I would just like to stand on existing protocol. I'm very delighted and honored to be here. Thank you for the invitation. I think digital transformation, clearly, it's not just about converting traditional paper-based processes by digitizing them. Digital transformation means we're able to leverage on technology to remove frictions for end users, be it patients, be it the doctors, providers, hospitals. How do we leverage on technology to improve processes that ultimately removes this friction? It means that a patient I mean, traditionally, if you're ill, a patient needs to go to the facility to see a doctor. Then they meet up with the queues. Then from getting to see the doctor for 10 minutes, they waited for 2 hours, traveled 1 hour. And then their record is paper-based. If they have to present at another facility, then they have to repeat the process again. You know, medical records don't follow them through. They have to look for where to get medicine, where to get diagnostic tests and all that. Whereas with digital transformation, the future of healthcare is click and brick, where a patient can seamlessly transition from a virtual access to a physical access where needed, carrying their medical record with them in an interoperable manner, whereby the continuity of care is preserved in the standard that is expected. So that means that if you're ill, you don't rush to go to the hospital because 60% of medical problems can be resolved virtually. You're doing your mobile banking, flight booking from the comfort of your phone. How much more for healthcare? So why do you need to travel 2 hours, waste productive time to go wait in the hospital for a conversation that can happen in 10 minutes and have your prescription dispatched to the pharmacy, is dispatched to you at the comfort of your space, home, office. You get your diagnostic test, the result is ready online. We spoke about rapid diagnostics, how effective they are. That can be dispatched to the patient at home and you do your finger prick, the result can be validated. Or even in a physical facility like the primary health centers where there are trained operators, the patient can see a doctor online without necessarily having to go through all that. So digital transformation for us means that we are able to leverage technology to remove those frictions. It's about the impact of the technology rather than just transforming a digital process, a physical process into digital.
Thank you very much, Doctor. Mr. Adham, when we talk about digital healthcare, people often think about telemedicine and electronic medical records, but the pharmaceutical supply chain is equally important. From Drugstock's experience, what are the biggest digital opportunities in medicine procurement and distribution?
Thank you so much for that question, and it's a pleasure to be here. I stand on all existing protocols, and I must say Professor Abayomi is an inspiring person. Our Minister of Health is certainly somebody that deserves another round of applause, so please guys give him another round of applause. That was quite inspiring. I mean, I've been in healthcare in Lagos State for quite a while, and just to see the transformation and the momentum being created by these gentlemen and ladies that are currently leading is quite transformational. In terms of your question, I think as Fumi said, it's all really interconnected. One does not work without the other. So you can imagine yourself as somebody that went to med school, graduated, worked for a couple of years to gather a bit of money to start your own clinic. And then you start your own clinic, you practice according to the best knowledge that you have, but then you prescribe a drug for a patient or a test for a patient, and the test is either unavailable, unaffordable, or the medication that you're dispensing is unavailable, unaffordable, or even worse, counterfeit. I think the entire healthcare system works in cognizance of a health system in itself, in its true sense. If the pharmaceutical supply chain does not understand when a patient needs a medication or what population pools need access, then it is all intuition and guesswork, and that also leads to waste in the system. So in my own opinion, I think AI is going to transform the way we interact with healthcare, not just from a patient interacting with us as healthcare providers, but also the way we interact with each other. And how we bring everything together to ensure that truly we can really talk about patient-centered care and not fragmented ecosystems that really frustrate the patient from trusting the medical system. I think the most important thing for us to do is ensure that we rebuild trust in the medical system, because sometimes it's not the doctor, but it's the frustration of the system that causes us to go through non-evidence-based ways of treating ourselves. So yeah, I hope that answered your question.
Thank you very much. Let me bring you back. Can technology help address problems of like medicine authenticity, pricing, and supply chain efficiency?
Absolutely. I mean, I'll give you some basic examples. There are some medications that have scratch codes and QR codes that you can definitely confirm the authenticity of a medication. And I think, generally speaking, that's a very simple, strong idea that should be adapted. What's actually even more interesting is the data that you generate through all these aggregations, which does not still exist in Nigeria. The ability to see where a patient is going and harness that data enough to make a decision is also part of why we feel like we're not advancing in the supply chain point to eliminate all these sort of fake drugs. Fake drugs in general are less and less being found in standardized operating facilities because they're learning to order from the right people. So even if it doesn't have the right sticker, there's still some things happening there that are questionable. But generally speaking, I think it's about the population that is not set up with your traditional big hospital or big pharmacy. How do we ensure that we encourage those supply chains to be healthy and sanitary? And it all goes back to one thing, what Professor Abayomi was saying, that everything is linked, from the fact that the medication, as soon as it comes into Nigeria, has a code that can be tracked, to the point of prescription and to the point of dispensation, so that we know exactly where our medications are circulating. So yes, technology has a huge role to play in this.
Thank you very much. Okay, let's talk about money. Healthcare is a social necessity, but healthcare business must also be financially sustainable. How do we balance affordability for patients with profitability for the healthcare enterprise?
One of the biggest lessons I personally learned in my career is that affordable, like healthcare and it being expensive are not synonymous. I don't think it's the better quality healthcare you get, the more expensive it gets. That is a fallacy in its own sense. I think there's always going to be a space for people that can afford healthcare to seek healthcare from places that are equally expensive. And I think if a business in itself is not sustainable, the hospital is going to shut down and not be there. And I'm a firm advocate of hospitals and pharmacies and healthcare providers should also have an innovation budget and should also research and plan for bigger projects going into the future. So I do believe that healthcare businesses should be profitable. Now, the real question is whether or not we're designing systems or protocols that make affordability an agenda. So if we're in an area whereby the consumption index or the ability to spend is low, and we see that 100 million of our population can only afford X, then how can I design scalable operations that consider X and still offer healthcare? To me, that is the equation. So healthcare quality and healthcare affordability to me are not synonymous, and you're going to see that eventually happen even from just AI being on anybody's smartphone and 60% of primary care being able to be discussed even before they interact with you.
Oh, thank you. Let's elaborate more on that. Dr. Shegu, what do you think about that?
In my experience, one of the biggest mistakes we have made in Nigeria is this concept of affordable care. It started with this alma mater declaration of affordable, accessible, and all those A's. And eventually the interpretation was that it should, whatever healthcare you want to deliver should be the cheapest. We mistake cheap for sustainable. And so we came up with a health plan with NHIS and said providers should take 500 naira as capitation. And we believe that if it's that cheap, you will have most Nigerians on it. And it failed, woefully. Because the average Nigerian is not risking his life for just the cheapest care he can find. In our experience in Care One, most hospitals we take over, we increase the average spend. But the patient experience goes up and the affordability goes up. I'll leave you guys with one story of a hospital we took over in Ilaro. When we took over the hospital, the average bill per patient was 7,000 naira. Because the typical thing is the patient comes, just like what the commissioner was talking about, the same epidemic of malaria and typhoid. Everybody has malaria and typhoid. So patient has fever, does MP, gets Coartem, bill is 7,000. 2,000 for consultation, 2,000 for MP Vidal, 3,000 for Coartem. So when we came in and we exploded this process to include full blood counts, urinalysis, things like that, based on whatever the doctor finds out from the clinical, from the history and a detailed medical examination, the average spend came up to around 30,000. And everybody thought that, oh, patients will stop coming. But we noticed there were more patients were coming. There was this particular farmer that I noticed kept coming, an old man. And I had to ask him one day, I said, Baba, before we came, you were spending 7,000. Now you are spending 30,000. And you are still happy to come. And he told me, he said, my son, before you guys came, when I spend that 7,000, I can't go to the farm for 5 days. Because just as the commissioner has said, most of the time it is not malaria. So he has to wait for all those for his immune system to kick in and sort out the problem before he can go back to the farm. And for every day I don't go to the farm, I lose 50,000 naira. Because when I go to the farm and I access my produce and sell it in the market, it's 50,000. So the true cost of care to me was never 7,000. It was 250,000 plus 7. And since you guys came and give me this 30,000 naira care, I'm back at the farm the next day. So it's cheaper for me to spend this 30,000 than to spend the 7,000 and stay at home for 5 days. So as a country, we need to come to terms with the fact that the cost of healthcare is not just the price of the treatment. It is the price of time away from work, potential complications, and even death. So we need to reset our mindset in terms of affordability. And we need to start thinking in terms of sustainability. And sustainability will include appropriate treatment, appropriate pricing, good patient experience, and then standard recovery strategies. My experience is that the average Nigerian is willing to pay 2 or even 3 times more what they are paying today to get better standard care. And if we can reset our mindset, we can get more of the citizens into the pool. Thank you.
Thank you very much, Doc. Dr. Fumi, do you think there's a point where investing in technology becomes a financial burden rather than a growth enabler?
Wow. Okay. Technology is meant to help to reduce friction, as I said before. It's also supposed to help to reduce cost significantly. We need to move from the traditional way of providing and accessing care, which is often late, reactive, hospital-based, to a tech-enabled early presentation, preventative health that is a click and break. I love the analogy that he just gave, and also the fact that 60% of medical problems can be resolved remotely. You wonder why telehealth, digital health is not at the center stage of cost-saving mechanisms. We're talking about the indirect cost of care, of the indirect cost of accessing care, which is not just the cost of buying malaria tablets, going for tests. It's actually the loss of productive hours. Most of the conditions that people present in hospital with are treatable virtually. We talk about the pyramid, where the base of the pyramid means that 70 to 80% of our medical needs can be resolved at primary health care level. And the remaining 30% go to secondary care, tertiary care. That is expensive, complicated, specialist care. What we have in Nigeria right now is a reversal of that pyramid, where 80% default to the secondary and tertiary centers. Of course, that's expensive. It's expensive. It overburdens the health system. We already don't have enough doctors. Cases like malaria, fever, pneumonia, UTI should not be ending up in the secondary and tertiary centers. They're expensive, time wasting, and have huge economic impact. Why don't people go to the primary health centers? Because we have about 30,000 primary health centers in Nigeria. Less than 20% of them are functional. Leaky roofs, no diagnostic equipment, no light. The staff there are poorly trained. They will not find a doctor. That's the reason why people don't go to primary health centers. That's why they go and default to secondary health centers. So it's expensive. So how can technology help to reverse this trend? Empower the primary health centers with digital technology. That means that Igbora, Nnewi, where they don't have doctors, could suddenly be empowered, enhanced by providing telemedicine. A doctor in Lagos can be seeing a patient far away in the village in Ekpe without physically being present. That way, we can enhance the quality of care delivery and improve trust and belief in primary health care. But significant number of patients don't even need to step a foot in that primary health center. So the primary health center will probably be for those who don't have digital skill, digital tool. So what we have done at Mobi Health is to leverage on technology, deploying them to primary health centers to show that these can work. So we deployed it across Ekpe, Lagos, Abuja, different parts of the country. And you see the primary health centers with these PHCs, with the telehealth facilities, all of a sudden now have access to doctors. The nurses are trained, they are supported, the community extension workers are supported, and you don't need to have digital skill or tool. There's solar, there's satellite, and that takes care of infrastructure problem. From as low as 5,000 naira a year, you're covering the whole community individually. I think that is how technology is helping to reduce costs. And then from the comfort of your home, you have the smart device, you can consult with a doctor, any specialist at all, because geographical barrier limits access to specialists, isn't it? So if you went even to a hospital, maybe a cardiologist is not there, an endocrinologist is not there. But from the comfort of your home, you could be seeing a doctor in London. You could be seeing a doctor in Abuja. So I believe that technology can help to reduce, it's not just that I believe, actually research has shown that technology can reduce cost of care by more than 40%. 40% technology in terms of improving electronic health record, in making sure that they are interoperable. Patients don't need to repeat tests from one facility to the other. Once the test is done here, if we have interoperable system, then the other level of care can see the result. So yes, definitely technology is here to improve. And I love the fact that health insurance, we're talking about cost of care, that affordability. Let me just digress a bit. I believe that it's a matter of priority for Nigerians and Nigeria, because we saw the data. The data don't lie. MTN spent at least 1.7 trillion naira. That's about 2 billion naira on data alone. On airtime and data, I think about 2.6 trillion. But on data alone, this is the spend half of the year. And yet, 95%, 90% don't have health insurance. People stay on TikTok. They are on Instagram. They are following Pella and Jarvis. But you ask them to pay 10,000 naira for their health insurance contributory. It's a problem. So I believe it's a matter of priority. That's number one. And number two is that, yes, affordability, healthcare affordability and quality, they are not exclusive. Somebody has to pay for care. Cheap and quality, they don't come together. But there's a way technology can help us to significantly reduce our cost, and that's what we need to think about. So we did health insurance. It means that we can drive more preventative health, reward behaviors. You have data analytics, predictive analytics. You can risk stratify a patient. I can see from your data that, look, because you have digital technology, you are now inputting your blood pressure over the last 6 months. This is your average. You have a high risk of cardiovascular disease. You have a high risk of stroke. You smoke cigarette. You're overweight. How about if we take these preventive measures, that can really reduce your cost of care. So I think technology has a very broad and wide range of ways that it can help us to reduce cost. Thank you.
Thank you very much. Dr. Shegu, you have the digital hospital perspective. What do you think?
Okay, so this is a very interesting question. Because very early on, first few years, we actually didn't deploy electronic medical record in the hospitals we were running. And people will say, how can you call yourself a digital hospital if you have not deployed an electronic health record? But the digital in Care One Digital Hospital is a digital mindset. It's not just about the electronic health record. And we recognize very, very early, well, if you look at my history, I've been doing this for 25 years, so it wasn't that early, but in the life of Care One itself, that you need to create that digital culture. As they say in business, culture eats strategy for breakfast. So you have to create that digital culture before you bring in the digital technology. So very early, we created a digital, complete digital ecosystem within our hospitals. Digital procurement, digital human resource management, finance, and then finally we layered it with our own EMR. So we've deployed our own EMR in all the hospitals, and almost all our hospitals run completely paperless. But the digitalness is in the way we do things. For example, our latest application is in digital clinical management. So we have a 100-bed babies hospital in Kano now, the largest in West Africa. And in 4 months, we've seen 1,800 babies. Nobody has ever reported those kind of numbers with a 96% survival rate. And the Katsina state government, for example, has reached out and they want 3 in Katsina state, not 1 like Kano. And at least 4 states are significantly expressing interest. If we're able to scale this nationwide, we can provide capacity to treat over 200,000 babies. For context, officially, 241,000 babies die in Nigeria. So we are going to be able to provide infrastructure to save over 80% of those babies, and maybe eventually up to 100%. So we are living in historic times such that a problem that has been with Nigeria for over 2,000 years can be solved in our lifetime using digital technology. And what is powering it is that we have a digital system now such that if you make a diagnosis for as mild to moderate asphyxia, the ICD-10 code is P34. So if you put P34 in your diagnosis space, the system will give you a 7-day episode of care. The system will tell you everything you need to do for this baby for the next 7 days. So we take in young medical officers, and in 3 days, they're able to manage a severely asphyxiated baby. And that's what is giving us the confidence that we can replicate this nationwide, even though there are less than 100 neonatologists in the whole country. So with the digital hospital concept, we can replicate competence. You can have a baby in Damaturu, in the whole of Katsina State, as a state government, they don't have a single neonatologist. They don't have any service for babies in the whole state. There's a federal medical center there. It has a 30-bed neonatal unit with 2 or 3 pediatricians. But as a state, they don't have a single service for babies. And for the first time, we are going there now, and we are setting up 3 in the 3 geopolitical zones of the state, and it's going to handle over 3,600 babies annually. And it's because our framework is digital, and it can be scalable and replicable with very little drop in quality.
Thank you very much, Dr. Shegun, for that insight into Care One. Let's look ahead. AI is probably going to be one of the biggest forces shaping healthcare over the next decade. What part of healthcare do you think AI will fundamentally transform? And what part should we be very careful about allowing AI to influence?
Thank you. AI is already, as I just told you about our, you actually call it diagnosis-related treatment templates. It's driven by AI. So we have a reinforcement learning engine in it now that is even trying to increase the survival rate from 96% to 98%. We're finding out what is special about those 4% that die, because the system is learning. So the parts that AI will always do better than human beings, AI will gather the data better, AI will analyze the data better, AI will always remember. So if you put a protocol and say every baby that comes, you must check so, and if this is positive, do this, AI will never forget. It does not have parties, it's not obedient or articulated or batified, it's never hungry, it doesn't have a wife or a husband. It will always do it, and it will always do it better than human being. So as a country trying to leapfrog, we can use AI to lock quality at a particular level. So we can just say every patient gets this. And we know that AI will ensure that that is done. But areas where we have to be careful is that, number one, as of today, the AI data, the data that is used to train AI is mainly foreign data. It's not African data. There is a research that shows that an AI expert system in the US was disproportionately recommending cesarean section for African Americans than Caucasians. And it was because of the skin color. So as Africans, we have to be careful how we swallow the AI there because it is not trained with our data.
Absolutely.
So that is one area. The second area is that with all the training they've done with AI today, AI still hallucinates. So sometimes it does not have the answer to what you are saying. It creates something that doesn't exist. So there is an accountable care model now that says AI is only permissible in medicine when there is a human agent at the end. So whatever the AI decides, there is a human being that must sign off and say yes is good or no. When I say our systems give you a 7 days episode of care, the episode of care is document. A doctor has to read it and say, I agree with this, and save with his credentials. And when you save it with your credentials, you are accountable. Whatever happens, you are responsible. So we have to still maintain that human agency such that no matter what AI decides, one human being makes the final decision. And all AI is doing for us is making recommendations. Thank you.
This has been very insightful. Thank you so much, Dr. Segun. Adam, what he said now brings me to my next question. Are Nigerian healthcare businesses prepared for the transformation, or are we going to be consuming technology developed elsewhere?
I think with the panelists sitting beside me, I think that answers the question for itself. I would like to congratulate them on their insight into AI and how it can be used. I'm not worried because I feel like we are a part of one of the most innovative cultures to come out of the world in a very long time. The amount of creativity, energy, education that's available in the Nigerian community and diaspora is enough for me to not consider that a threat at all. I actually think we're going to lead the drive because we also have different dynamics in Nigeria, including Lagos State that has an intensely dense population with severe limitations to how our healthcare providers can be accessible. So if anything, we are going to innovate the process and teach the world how to do this. So to me, I don't think that there's any cause for alarm, but I think we should definitely encourage our innovators, encourage people playing in this space, ensure that we have firm backing to create ecosystems that make them successful to keep innovating as well. If I'm to say something is on the AI topic, I think preventative healthcare and education, individual education about a person's health, I think we underestimate that impact on our healthcare system in the next 20 years. The amount of conscious teenagers I've seen that understand, perhaps it's because they have access to AI, or perhaps they're just more interested in their health, as opposed to our generation that was more interested in the party, maybe. But the point being is that I think the fact a self-educated consumer always helps the system flourish and always creates more accountability for people offering a service in that space as well. So I do anticipate that it's going to be an amazing 20 years of innovation, and let's take advantage of the complexities we have in our systems here to create templates and models for other African cities and maybe the world.
Thank you very much. We are coming towards the end, so I'd like to do a quick round. I'm going to give one question and I'd like a short answer from each of you. If we were starting a healthcare business in Nigeria, what is one digital capability you would build from day one?
Interoperability. Interoperability is key to scaling healthcare businesses in Nigeria and anywhere else. Right now, we have so much fragmentation. HMO's data is different from the hospital data. They don't speak to one another. Private sector have data, they're sitting in silos. I think if we can put together the interoperability framework and resolve that, that would be the best. Because at the end of the day, AI is only as good as the data underneath it. And as Segun has said, the buyers at scale is inequality at scale. And if we are feeding the AI with the data that is not representative of our own population, then there lies the risk. So I believe interoperability is going to be the best to consider. Thank you.
Thank you.
I can only pick one.
Tell me.
If I had to narrow it down to one thing, I would say every business today should know how to store their own data, should understand the parameters that matter for an algorithm or for an AI, and should understand how to keep this as safe as I keep my financial records. Because we're moving so fast that all I need in 3 years is to plug in all the data I could about my business. And I guarantee you AI is going to be smarter than any consultant you hire as to what the next step is or what the next direction in what you should pay attention to. So I'd say small business, big business, individual healthcare provider or large healthcare provider, keep and store your data.
Thank you very much.
Okay, the one skill that I would like to learn if I was starting in healthcare business now is the skill of delivering sustainable healthcare. Healthcare that is sustainable. And for us in Care One, it's a balance of the quality of care, the patient experience, and the profitability. It's a triangle. So I would like, maybe use AI to find that balance. How much quality for how much price at what experience? Because that sustainability will drive the traffic will drive the data and everything we talk about. And when you have traffic and data and you have profit, you can now scale. But without this sustainable model, you will not have enough traffic and you will not have enough data. You will not have a profit to invest in any technology to do any interoperability. You have nothing. Thank you.
Thank you very much. And here comes the last question. What is one thing the Nigerian healthcare ecosystem needs to fix if we want healthcare businesses to scale? Please go ahead.
So the one thing I think we need to fix is the trust. The trust in the system. The trust drives everything. As Fumi mentioned about what we spend on one mobile provider, in half a month. There's enough money in this country. The problem is not there's enough money, there's enough technology, there's enough people, there's enough everything except trust. So if we can fix the trust, every other thing will be added onto it. Thank you.
And on the back of that is collaboration. Collaboration is very key. There's no need to reinvent the wheel. How do we leverage on our individual strength as providers and collectively win in this market? And again, that falls back on what he has said, because the lack of collaboration may be as a result of lack of trust as well as other factors. So we need to learn to collaborate together, private partnership, before we talk about private-public partnership.
Thank you. I think I would steal Fumi's answer from the last question. I think interoperability is an essential part of scale. I think if we can all talk to each other and have a framework and trust that the medication that we're given has a supply chain that is bulletproof and be able to reach any specialist I need because they're all on radar or all are visible, I think these are things that will enable us use AI, but also scale in a humane way and in a human way. I think trust is always going to come back to the person that you are looking at to seek healthcare. So I think empowering, and to not miss them in this conversation because we spoke a lot about AI, but empowering our actual healthcare workers, like the opportunity and the lifestyle that they live, I'm pretty sure we can do a lot better for them to ensure that we get the most output from them, because they're going to be the interface between a lot of intelligence and humanity. And we need the humanity more than we need the intelligence at that stage.
Thank you very much to our panelists. What we have heard today is that digital transformation is not simply about technology. It's about people. The financing, infrastructure, regulations, trust, like you just said, partnership, and ultimately building businesses that can survive long enough to make a meaningful difference. Please join me to appreciate our panelists.
Thank you. Thank you so much. Please, let's appreciate our moderator. She has done so well. Panelists, please hold on. I believe we have the plaques for them. Can I have the team? Mr. President, please do us the honor. Joined by the chairperson of the, yes, we will take the questions. There's another place for question and answer, so I want to take everything together because of our time. Mr. President, we'll take the first photo. Please, let's create a space for the president here. So, please, as we get to the plaque sessions, I want the staff who is handling the plaque to be here, please. So that saves our time. Are we good? So hold on, we'll get the plaques. Please let me have the first one. Okay. Mr. Hada? Yes, please come near to the president to take your plaques. Next. Dr. Fumi Adewara, you are next. Thank you. Dr. Shegun. Dr. Shegun, a bit on me. Dr. Shegun, this way. Okay, that's fine. Our powerful moderator. Thank you. So we'll now take the last one, holding your plaques. All right? So let's take the last photo. Yes. That's good. All right. Thank you so much. Thank you, Mr. President. Thank you. No, we'll take the question later. Yes, we want to take the next session, then we'll take the questions. I believe they are written down the questions. You are not going yet now, Dr. Shegun? No. Yes, we'll be done in a few minutes.
Every skill to learn, every juice to bottle, every night you chose work over rest. It keeps the receipts, and one day it sends the bill. But it is not too late. See a dietitian before your body has to remind you. Prevent today, live tomorrow.
Hi, my name is Emeka Namoy, a pharmacist at Moorcare Pharmacy, a family-oriented establishment serving a vast community for over 4 years. We stock a wide range of products ranging from vaccines, vitamins and supplements, antibiotics, antiretrovirals, skincare, and a whole lot more. Our services include consultation, dispensing and retailing of pharmaceuticals, drug use review, and delivery of pharmaceuticals to your doorstep. Oh, and recycling. Getting easy access to better healthcare is the secret to healthcare living. Order prescriptions or shop online with us today.
Right, thank you so much. We'll move into what happened, what we can consider as the last major thing for today, which is the fireside chat with the team leading healthcare in digital age, building resilient and sustainable health enterprises. We have with us this afternoon, Dr. Adeolu Arogundade. Let's invite Dr. Arogundade to the front row. This will be moderated by our major moderator and super moderator, I must confess, from Nnenna Omeke. Let's put hands together for her. This is for 20 minutes. Thereafter, please pen down your questions. We'll then take the questions arising from here and the ones with the panelists once and for all. Thank you.
Our fireside conversation now takes us from a broader healthcare ecosystem to the question of leadership. I am delighted to welcome Dr. Adeolu Arogundade, Medical Director of General Hospital Isolo. Thank you for joining us, sir.
My pleasure.
You have led within the public healthcare system. What has healthcare leadership taught you that you did not expect when you started?
All right. Let me start by talking about the fact that at both the public sector level and private sector level, what people want value. And I realize that wherever value is provided, people will go there. Whether it is and the private sector or the public sector, I think the difference sometimes is how the value is perceived. But basically, let me just leave it at that. I think everybody wants value, and everybody wants value for the money they pay for healthcare.
Thank you very much. So, healthcare leaders have had to navigate increasing patient expectations, resources constraints, workforce challenges, and rapid technological change. What does resilient actually look like for a healthcare organization?
Okay, so in an environment like ours, resilience has to be a broad term that we have to consider in long-term plan sustainability of a healthcare institution. For example, I'm not sure it's the same around the world, but if you're planning a healthcare institution in Nigeria, you have to consider power. And these are supposed to be givens. If you are running a healthcare institution in Nigeria, you have to consider water supply, and so many other things like that. So for an institution that is going to be resilient, you have to design all of these things into your primary plan. You have to have backups. You have to, I like to describe it as being able to, if the push comes to shove, you have to be able to degrade gracefully rather than collapse. For example, earlier we had the talk about JAPA. So how do you deal with, you have built this massive healthcare institution, and I was privy to some information just a little while ago. Lagos State government was trying to employ certain cadre of specialists, and then they had, with about 50 positions to fill, they threw out invitations for interview, and only 19 people showed up. And then, of course, you will have to consider employing all the 19. And then, at the end of the day, less than 5 picked up their letters of appointment. How do you deal with that? So, you building an institution, and then you are going to be left with, I run an institution, and one of the biggest challenges I get day in, day out is that people come. We don't have enough people running this clinic. This person has left, that person has left, this person is sick today, and then who is going to run the clinic? So a resilient system is one where you must be able to continually figure out how to manage resources. For example, the sun is not out today, or the power grid is out for the next 6 months. How are you going to manage it? Are you able to, do you have an alternative source of power, or you are using a digital system and then you don't have a backup? A resilient system is one where if your EMR is based in the cloud, do you have a local backup that can run it? Your staff, you don't have adequate staff. Do you have people that can task shift and take up roles? And then we talked a lot about AI in the last panel. I think one of the biggest things we need to look at AI doing is not to replace the clinician, but to help the clinician manage his time so that you can buy him more time. There's certain things clinicians have to do. Why can we use AI to, take up some of the work? For example, everybody has to listen and write in a consultation. And those parts are things that you can put to AI or use some other technology so that you have more time for the clinician who can see a lot more patients. So a resilient organization is one that is going to be able to withstand all of this shock. And there will be shocks if you live in a country like Nigeria.
Thank you very much, Doctor. One more question. Can an organization become so focused on surviving today's challenges that it loses the ability to prepare for the future?
I think that happens commonly, and it's not hard to imagine. If you are in a country like Nigeria, and there are so many challenges every day, day in, day out. Today, there's power outage. Tomorrow is one other issue. I run a hospital, and when I come in the morning, I like to take the first few minutes to try and plan the day. But as soon as you are ready to, then there's a deluge of various kind of problems coming up that your system isn't able to handle. So I think it's easy for the leadership of any health institution to get overwhelmed with the challenges that they face on a daily basis, and they forget to think about tomorrow. But I think what we need to be talking about is that every institution must sit down and have its short-term, medium-term, and long-term plans. You must have your goal for the next 10 years, for the next 50 years. We heard about the Lagos State government's 30-year plan. You must have those kind of plans, and from day one, you must start building systems that ensure that those plans, it may not be what it should be in, but it starts out, you have a layout, you know what you are working towards. So every day that you have a fire brigade incident, you know that it's just one of the things in your short-term plan. But everything else is working towards a long-term plan. So yes, organizations do get overwhelmed with issues of today, but you must never lose focus of what your ultimate goals are. Thank you.
Thank you. So we should focus on the strategy.
Yeah.
Thank you very much, sir. When we talk about leading healthcare in a digital age, do you think the biggest challenge is actually technology, or is it the willingness of people and institutions to change?
So I like the way Dr. Segun Ebitonmi described it earlier at the panel session. You know, digital transformation is not the same as having an EMR. It goes a long way beyond that. I think digital transformation actually starts with the leadership of the organization and is nothing about buying technology. I think the transformation means that the leadership of the organization begins to put structures in place that can support digital. I remember an incident that happened, I think about 17, 18 years ago, when the Lagos State government first decided to do digital transformation, set up an EMR in one of their facilities. And I was part of the process at the time. And then we discovered that we're putting computers in places, and then people would disconnect the computer and then use them to watch Nollywood movies in the evenings. And then people went to all kinds of places. Before you knew it, the computers picked up all kinds of viruses, and then the whole system became infected because there was no change management. So digital transformation is not just buying computers, it's setting up systems. Systems that allow our hospitals to run paperless, that allow change transformation. One of the panelists talked about interoperability. It's such a crucial part of the design from start. One of the areas I feel that health facilities don't take advantage of enough is the business intelligence solutions that we have. And that happens because you don't understand the data. So the data will tell you where you are bleeding. The data will tell you where you should put your attention to. And all of that are digital issues, but it's not the EMR. So in digital transformation, we need to envision what we want to accomplish. The digital should be the tool, and then we can now begin to plan around that. Thank you.
Thank you very much, sir. Let's talk about sustainability. What does a sustainable healthcare enterprise mean to you beyond just making money?
Okay, so for me, and we did hear the Honorable Commissioner for Health talk earlier about a bigger plan. And if you think about it, think about Lagos, think about Nigeria. I like the plan of Lagos we saw earlier on. But think about Nigeria, we're going to be about 300 million people in another 10 years. 300 million people, what hospitals will they go to? Lagos State has by far the highest number of healthcare facilities in Nigeria. Lagos State has by far the highest number of healthcare facilities, hospitals to be precise, in Nigeria. And yet, hospital bed per patient in Nigeria, Lagos State ranks about 15. That means a state like Nasarawa has more hospital bed per person. The future of healthcare in Nigeria is going to have to change, and not just Nigeria, the rest of the world. As our population continues to grow, our resources continue to dwindle, and the kind of illnesses we see will continue to grow. For example, beautifully so too, our life expectancy is actually increasing, although slowly, but around the world, as healthcare improves, people live longer. And that's why we say cancers are growing more. But the meaning of that also is that we will have more healthcare disease burden. We'll now have the chronic diseases to deal with, more diabetes patients, more hypertension, and more oncology issues to deal with. And yet, we have more people. And the number of hospitals, there can just be so many hospitals in the small size of Lagos that we have. The meaning is that we have to reinvent healthcare. We have to reinvent healthcare. Healthcare in 20 years' time cannot be the way it runs now. And I'd like to use the example, if time will allow me. During COVID, the Lagos State, the Honorable Commissioner for Health and his team realized that they were admitting COVID patients, and they kept admitting them, and then soon they ran out of isolation centers, and then they commandeered hotels, and they began to admit them. And soon there were no more hotels to you know, and at the time they said that we couldn't continue like this. And then they started admitting patients in their homes. You see, they had to reinvent the system to make it sustainable. And I think there has to be a major shift in the way healthcare is delivered if we're going to remain healthy the next 20 years. Now, for a sustainable business today, you must start thinking about that. You must start thinking about a system that can evolve. You must start thinking about a system that can pivot into other ways of delivering care if you are going to remain alive in the next 10 years. Thank you.
Thank you very much, sir. Sir, how do we build institutions that remain strong even when the person that founded it or is currently leading it is no longer there?
So that's pretty much straightforward. It's by building systems. There are many talents, many innovative people in the country, and many entrepreneurial minds. And sometimes we get allowed the zeal to get ahead of us. But the biggest challenge, the biggest thing any entrepreneur has to learn is how to build systems, because the systems will tend to run themselves better. Again, I refer to what Dr. Ibitomi talked about earlier, and he said that in 3 days, they could have a medical officer learn to manage a particular medical pediatric condition because there were algorithms. Those are systems. People will run with the systems. Compare that to the physician having to be the one to do all of that because he can't find people that understands what he's saying. So things that technology will help us to do is build systems. There are clinical decision support systems that we can put in place, and I have protocols that our officers can follow, that our team members can run, have systems that ensure that we continue to manage the funding and the resources of the organization and the supply chain system, have systems that run all of these things. And then the founder can step aside and look at how the system is performing, look for other areas of getting the organization to continue to run without being necessarily part of the operations. I think that's a way to build sustainability. Thank you.
Absolutely. Thank you so much, Doctor. If you were given the opportunity to redesign one aspect of healthcare delivery in Nigeria using technology, what would you change?
Okay. I think this is similar to one of the questions that was asked earlier. A few things that, one thing that I would change? I'll say two things, and I'll first of all say interoperability, as said by the panel. Most of the panelists alluded to this earlier on. It's because one of the key challenges we have currently is that our system is fragmented, and my healthcare record does not follow me wherever I go. And that itself is a problem for delivery. So I'll say interoperability because we need to be connected. But again, I'll say something else. I'll say, if I was allowed to change something, it's something that allows access universally. Because as much as we are talking now, we're in the center of the city. There are people in rural parts of our country that won't even have a smartphone or won't even be able to access care. They won't have the opportunity of visiting even a primary care center is remote to them. So I think one thing that I want to look at would be the capacity to make access available through maybe the mobile technology. Like we had the likes of the MTNs. There's an average person in Nigeria actually has access to a phone. For those that don't own one, they stay with somebody that owns one. And I feel that the mobile system, mobile phone technology can help to give access to healthcare across the world. Dr. Fumi was working on, some telemedicine solutions that if government is able to make funding available, can actually connect health insurance to people living in a remote part of the country. And for me, so that will be one of the things I will want to work on, because it allows us to give access to the vast majority of Nigerians that are currently experiencing so there's digital divide. Because as we move technology into healthcare, we create a gap of people that can access it because they don't have that digital opportunity. So I'd like to look into that access part. Thank you.
That's brilliant. Thank you so much, Doctor. What do you think the healthcare leader of 2035 will need to be good at that today's healthcare leader may not necessarily need?
All right, so 2035 is just under 10 years from now. Like I was saying earlier on, I feel strongly that the way healthcare is being delivered today will not remain sustainable in the next 10, 20 years. I think a leader in 35 will have to be able to re-envision healthcare. Now, so today what we have is you are sick, you go to hospital, you get registered, there's diagnosis, there's treatment, and you go home, there's follow-up. I think that healthcare will have to be put in the hands of the healthcare consumers. I strongly think that, and because even right now, healthcare has been strongly correlated with patient engagement. Today, we have people on TikTok talking about healthcare. We have, I'm sure more than half of the room have some wearables that track how much steps that they have taken and things like that. So I feel that very strongly we will have to take healthcare beyond the walls of the hospital, to the homes, to the streets where people walk, so that we can track their health. They can track their health by themselves. They can monitor themselves. And with solutions like telemedicine, we may be able to, provide them care even right in their homes. Because our hospitals will not be enough to take care of all of them in the next 20 years. We must have a system that focuses on preventive health care, encourage them to take more steps. Things like, if your watch shows that, if your watch shows that you have taken 10,000 steps today, maybe you get 0.01% deduction in your tax. Something that incentivizes people to stay healthy so that we don't have to spend the money. So for me, the healthcare of the future will be different from the way we deliver it today. And we must have a mind that is open to change. Another thing is crowdsourcing. There's a lot of wisdom in what is happening on social media. We may learn one or two things from there and see how things are being done so that we can start changing how we deliver care. But for a fact, I know that we will have to put healthcare in the custody of the healthcare consumer. The patient engagement has to be stronger, and we have to focus a lot more on preventive healthcare. Thank you.
Thank you very much. This has been a very insightful conversation. Thank you very much, sir. So for the young doctors, pharmacists, nurses, entrepreneurs, and healthcare professionals in this room who would want to become leaders like you at some point, what is one lesson you'd want them to carry with them as they leave here?
I'll say that you should keep an open mind, be ready to change, and look to think outside the box. I just said that I don't think that healthcare in 20 years' time is going to be the way it is. You will be the one running that healthcare system, and you must be ready to think outside the box. You must be ready to envision something new, done in a different way. So that's what I will encourage them with.
Thank you, Doctor. It's been a pleasure having this conversation with you. Thank you. Thank you.
Thank you so much, Doc. Please hold on. The president would like to make a presentation to you. Please, can I have the officer in charge to please bring out the plaques for Dr. Adeolu? Please, can somebody help me get Adebimpe? She's supposed to be in this hall. Francis, please help me with the plaques. You see Dr. Adeolu. I think yes, it might be that one. Dr. Adeolu, is that? Thank you so much, sir. Thank you. Do we have other presentations? Mr. President, for our sponsors, yes. Yes, Atlantic Plus Solution Nigeria Limited. Do we have?
Atlantic Plus.
Is that the only one we have?
Yes, sir. Interoperability. Already it's good.
Thank you so much, Mr. President. Thank you, sir. Thank you. Thank you so much. Thank you, ma'am. I promise that I will give the opportunity for question and answer. I also know that time is no longer on our side. So I will give the opportunity, one person per role, to capture the questions we need to ask. Please, I still want Adebimpe to be in this hall, or Kende,
and collaborators to connect.
Please, Taye Adepoju, please hold this microphone. So for this role, one question. This role, one question. The last role, one question. So I will do a guy and two ladies. Yours. So I have a lady. Yes. Please, let's give it to the lady.
Healthcare is now at that same turning point. A single patient may need a
pause the
clinic,
video,
a
please?
specialist. And
Thank you. Thank you. Yes. Have this. Have this. Your name?
Good afternoon, all protocol observed. My name is Nneka Nwarose from Healthcare International. I have a challenge with tax. And we have vendors or consultants that help to sell our products. Just recently, we got a notification that we should pay VAT on the commission paid to these consultants beside the withholding tax. So I need your advice on that. Secondly, the Lagos Traditional Board, is going around. I won't say they are harassing people. I say that they have to certify a place of your office or whatever, and then you have to be paying annually. I think NAFDAC regulates this, and Manufacturing Association. So where do we go from here? Thank you.
Okay. All right, noted. Please, your question.
My name is Abimbola Oluokun, a private sector person, and then I'm an investor. My question goes straight to Dr.
Adeolu.
Shegun. No, Shegun. In his opening
Okay,
remark,
Dr. Shegun. Okay, he's there.
Shegun Ebitokun.
He's here. He's here.
Yes, in his opening remark, he made something about the proximity, location, and the outcome. And he concluded that outcome is more better than the location. What does that mean? What of in the situation of emergency? What will happen? So the accessibility is very important. And then location is better in business. Then, okay, outcome is very good too.
Thank you, sir. Last on the roll. Okay, I was going to give it to a lady, but apparently.
Thank you so much. My name is Samuel Okoli. I own an independent digital agency. And my question goes to the panelists that spoke about digitalization and technology in the healthcare sector. My question is, for a young entrepreneur like myself that is looking to provide solutions in the healthcare sector, what is the number one problem I should be looking to solve?
Number one problem? All right. So, responses, so I'll give to Dr. Adeolu. I believe he has a response. Then Dr. Shegun will also cap it. Maybe Dr. Shegun can then help, or you can also help with the problem you should be looking for.
All right. Is that I'll start with the young man that started. I think that's one of the challenges you need to face as an entrepreneur. You have to find is you can't create solutions and look for problems. So where you start from is what are the problems that are in the environment, and then you create solutions for them. So and it's not far-fetched. If it's in the healthcare industry, pay a visit to one of the healthcare. Try and follow someone that is trying to access care, and you will see the challenges that they go through. And from there, you may be inspired to find a solution. Very quickly, with regards to the lady that has talked about the traditional board, Lagos State Tradition Medicine Board. Yeah. Interestingly, I was in one of the meetings where the director, the DG there, the GM there was talking about some of the issues they faced. And it was quite embarrassing to hear how it's not only in medicine that you have quacks. In traditional medicine, you also have quacks. So it cuts across board. And I recall then that the gentleman was talking about how they were trying to comp by, regulating more. And a lot of harm gets done from some of those quacks because some of the problems that end up in our hospitals were generated from there. So I think the issue they try to address is the issue of the quackery that goes on at that level. I'm not sure how the process of doing it is, but I strongly feel that's what they are trying to address. And you may reach out to them and find out reasons why they are doing what they are doing. And you will get a lot more answers. Thank you very much.
Thank you, sir. So, Dr. Shegun.
Okay. So, sir, you asked, I think that was the first question I was asked, which is more important for scaling? The patient, the location, the finance, or the outcome? And I said the outcome, right? And you are bringing a hypothetical situation where if a center is too far, cases of emergency, bottom line is emergency or no emergency, the outcome is supreme. There's no point having a location behind your house where they will kill you. So at any point in time, the outcome is supreme. It is after a center can guarantee outcome that you think of convenience. So that's the principle of medicine. It's not about convenience first. The first thing is, can this center deliver the right outcome? If that center cannot deliver that, nothing else matters. So that's the way. That's the difference between healthcare business and every other business. Because in every other business, you are managing finance, you are managing cost. Basically, you are managing convenience. But in the healthcare business, you are managing the life first before the convenience. So a healthcare business must even tolerate some losses just to preserve life that other healthcare businesses may not tolerate. That's the structure of the industry. In Care One, our mantra is that the global economy is worth $200 trillion, but it can't buy one life. So everything we design is to spend all the costs to make sure nobody dies first before we look at any other thing. So that's the way healthcare business at least should be. I know not every healthcare institution adhere to that standard, but that is how it should be. Everything should be about safety before every other thing. And then the young man that is coming up and looking for the most important problem. Like Delu told you, you have to find your own path. But I can still give you some pointers. The first is, as you must have heard, the health insurance coverage is still less than 10%. The informal sector, 90% of Nigerians still don't have a health plan. So if you can come up with an application that can allow people to enroll for health insurance. I can tell you it's a winner if you can. Of course, there's a very, very big if. But that is one low-hanging fruit to just look at. Thank you.
Thank you, sir. Thank you, Dr. Shegun. Thank you. I believe our brother has gotten one problem he can go home with and go and provide solution. All right. Once again, thank you so much for a great day that it has been for us today. I believe Dr. Ayobami is fulfilled having held this today. On that note, we'd like to bring up for a closing remarks or vote of thanks, Mrs. Olajumoke Oshosonya. Please put your hands together for Olajumoke. Please, let's clap for her well.
Thank you, sir. Thank you, everybody. I am sure that we've been enjoying the session so far, so I'll move on to the closing remark. Distinguished ladies and gentlemen, it falls to me to close the day that I suspect none of us will close in our minds for some time yet. We came here this morning under a theme that reads almost like a challenge: transforming care, the business of healthcare in a digital world. And what we have heard over the last few hours is that the transformation is no longer coming. It is already here. The only question left on the table is who moves first and who moves well. So permit me to give honor where it is richly due. To the President and Chairman of Council of Lagos Chamber of Commerce and Industry, Engineer Leye Kupoloye, and to our Chairperson, Dr. Ayobami Kumuro, thank you for setting the tone with such clarity and for the leadership that carried the group to this moment. To our special guest and Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi, thank you so much for sharing something rare. He's not here right now, but we can reminisce on how he spoke of the business of care in a state of 30 million people, guided by a 30-year development plan in which health alone carries 12 strategic pillars. He highlighted the target plainly. Half of the residents insured, a 15% rise in government health expenditure, and health indices that move in the right direction. It showed us what implementation looks like in concrete. For instance, Ojo Iba Hospital nearing completion, the Mental Health Institute in Ekpe, the new Shomolu General Hospital, and the Lagos Comprehensive Cancer and Diagnostic Center. It told us that Lagos has domesticated the National Health Insurance Authority Act and is delivering it through awareness, enforcement, partnering with HMOs, standardizing premiums under Lagos private health partnerships, and provision for residents who cannot afford to pay. And he left us with two ideas that will outlive this hall: Medipac and precision medicine built on public-private partnership. And perhaps my favorite line of the day was the quietest one. And the data now tells us not every fever is malaria. That single sentence is an entire argument for investing in diagnostics. To our keynote speaker, Mrs. Fola Laoye, Chief Executive Officer of Iwosan Healthcare, also appreciated in absentia. She confirmed that funding markets for healthcare has grown, but also careful to tell us what capital is actually looking for, which is data governance. that it now stands beside accreditation in importance, and that it determines whether funding chooses you or passes you by. Healthcare does not reward impatient investor. It rewards the one who stays. Thank you so much, Mrs. Laoye, for challenging this room. To our panelists, Dr. Segun Ebitomi, Dr. Fumi Adewara, and Dr. Adam Yeya. Thank you for generously sharing not only your successes, but also your strategies on how you leverage digital technology to make healthcare accessible to everyone and reduce mortality rates. And this is by redefining affordability and improving patient health outcomes. Scaling a healthcare business in this economy is not theory to any of you, and it showed. And to our moderator, Fam Nena Omeka, thank you for holding that conversation with a great skill and for returning later to lead our fireside chat with Dr. Adeolu Arogundade, whose reflections on building resilient and sustainable health enterprise gave us a fitting close to the substance of the program. To our sponsors and partners, Atlantic, Eroson Lagoon Hospitals, PB Global Industries Limited, Malcare Pharmacy, JNCI, Carol Air Clinic, WellPath Physiotherapy, and each of our supporting partners. This symposium exists because you believed it should. Your investment did not merely fund program, it built a room where the future of Nigerian healthcare could be argued out loud. We're deeply grateful. To the LCCI Secretariat, the Planning Committee, our media and technical partners, and every member of staff who worked long before any of us arrived this morning, thank you so much. Excellence of this kind is never accidental. And finally, to each of you who chose to spend a working Wednesday in this hall, you are the reason this conversation has weight. Thank you for your presence, your questions, and your attention. Let's not leave here merely inspired. Let us leave here committed. Pick one thing you heard today, maybe data governance, your insurance mix, or diagnostics. Take it back to your practice, your pharmacy, your hospital, your board, and act on it before the memory of this room fades. On behalf of the Medical, Pharmaceutical, and Allied Service Group of the Lagos Chamber of Commerce and Industry, I thank you all most sincerely. This symposium is hereby brought to a close. Thank you and God bless you.
Thank you so much for that wrap-up. And a close on that note, we'd like to say this has come to a close. We will be upstanding to take the national anthem for a close, but we can still network and relate with others. Please, let's have the national anthem as we close for the day.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians home and proud to serve our sovereign fatherland.
Thank you.